Hi, everyone, and thank you for watching On Call for All Kids. Today, we're going to be talking about everything you need to know about your child's upcoming surgery. We'll be going over measures that are in place for your child's safety, the process of scheduling a surgery, and what to expect the day of. I am joined by Dr. Paul Danielson. He is the chair of the Department of Surgery at Johns Hopkins All Children's Hospital. And it's so great to see you, Dr. Danielson.
It's great to see you again too, Ashley. It's a pleasure to be here.
So as we know, the pandemic did slow surgeries for quite a bit of time due to this pandemic, but we have since resumed them. Can you kind of talk about the process of reopening things and sort of those safety measures that you talked about to get in place?
Absolutely. You know, it's very rare to stop doing surgery in a hospital. And so most hospitals are not prepared to sort of shut down and restart again. So when we planned on how to do this, the number one goal was safety. Safety for our patients and safety for all the staff taking care of them. Because, you know, keeping patients safe is really what we're all about. And if our staff isn't safe, then they can't participate and carry out our mission as a hospital. So what we did was we went ahead and we figured out what's the safest way to bring a kid into the hospital and get him or her the operation that they need. And first off, you know, we decided that every child needed to be tested for COVID-19 before they could come into the operating room area. This was one, safe for the child so that we could tell whether they had the virus or not, but it also protected all the other children and families that were going to be in the operating room area as well. And also, you know, it protected our staff from being exposed to the virus and then potentially spreading it to other people. And so that's why we've instituted universal COVID testing for any patient having an operation at Johns Hopkins All Children's Hospital. The other thing that we did when starting surgery again was to make sure that the people accompanying the child in for the operation were appropriately screened. And so when they came to the hospital, the first thing we said is, you know, I know both parents want to be here. I know maybe grandma and grandpa want to be here, but for the safety of everybody, let's just have one person come. That minimizes the chance of any disease spread if one person happens to have COVID-19. And so only one parent or guardian could come with the patient for the operation. And when they get here, we ask them a battery of questions to make sure they don't sound infected to us. So those are the two main things, especially for viewers to understand. Behind the scenes within the hospital, we've taken many steps. We've changed the way we've configured our waiting rooms. Now most families or most parents or guardian would wait in a room all by themselves while the operation is going on. So the risk of them contracting something or spreading something to somebody else is very, very small. Our staff wears special protective equipment that at first a lot of families find a little unusual. People coming in wearing face shields and all sorts of gowns and robes. But again, it's also that we don't spread this virus if anybody happens to have it. And then, you know, the third thing that's going on behind the scenes is that, you know, all the processes we have, like we have checklists before we start an operation. We have like, you know, different places along the way where we pause to make sure everything's lined up and all our ducks in a row before we do an operation. All that is still there and still exists. Although the family doesn't see it, that's really crucial to doing a safe operation. And so we made sure that that remained untouched when we were starting up again. So it was that foundation was always there.
How are surgeries being scheduled now? Is there any difference from before? And what should families sort of know about that process?
That's a great question. So the scheduling process, for the most part, is the same as it always is. You know, either the patient's surgeon or the hospital itself reaches out and picks a day for the family. And during that initial, it's usually a telephone encounter with the family, you know, a lot of information is exchanged. We learn about the patient and any special needs they may have. But at the same time, we convey to the patient sort of what to expect when they come into the hospital. And the biggest change in that whole scheduling process now is that the patient needs to make one additional trip to come in to get COVID tested before they actually come in for the operation itself. And that COVID testing has to be done right before the operation, because if you get the COVID test 2 weeks in advance, well, that doesn't help because you might get the virus between then and when you come in to get your operation. And so we've sort of set the rule that you need to have the COVID test 48 to 72 hours before the operation. And so when the scheduling office talks to the family and sets up the day for surgery, they'll also set up an appointment for the patient to come in to get COVID testing. And right now, we've set up COVID testing centers. We have one in St. Pete and one in Tampa, and we're probably going to open up some more, where patient comes in, it's a quick visit, maybe only 15 minutes. They get the COVID test sample taken, and then the result is available the next day. If it doesn't detect any virus, then we're green light, good to go, get your operation. If it does show that you have a virus, well, we'll let your doctor know so that you can get the appropriate care that you need. But we're also going to postpone the operation because, we're talking about an elective surgery. Let me add one more thing about the COVID testing. The reason that we're doing it at just a couple of those sites is so that we get very accurate results. It's been shown that if you don't have the right people gathering the sample, which is like a Q-tip up the nose, it sounds a little gross, but that's what we have to do. If you don't have the right people doing the swab, then the results from the test generally might not be as reliable. And so that's why we have specialized people who just know how to collect these specimens from kids. Because I think any parent out there will know that if you sort of come at a toddler with a Q-tip and you want to try to put it up their nose, they're not interested. So we have the people and the skill set to do that for them.
Yeah, that's really nice to hear. Well, hopefully those tests come back negative. We're glad we'll get them the proper care they need if that's not the case. But then comes the surgery day. What do parents need to know the day of the surgery?
Another great question. Well, just like when they did the scheduling for the operation, the hospital was communicating with them. The hospital is actually going to call them the night before the operation to give them some reminders, what time to show up, make sure just one visitor is coming. They may even ask, hey, have you come down with a cold? Do you have a fever? Are you having any symptoms that might be COVID related? Because we'd much rather handle that in advance than when you kind of show up for the operation. And so most families feel like they're getting the information they need to know before they come in. We also have a website. If you go to our hospital website, and you can, there's links to all the information you need as well. So they show up that morning, they get their screening, they come in, they check in, they get to put on a little hospital Johnny, and they get parked in a private room where the staff will come in and just go through the usual process of getting you ready to have your operation.
All right, Dr. Danielson, thank you so much for joining us and telling us all about how the surgeries are working right now at the hospital. We appreciate you.
Well, my pleasure, Ashley. You have a good day.
Thank you so much, Dr. Danielson. And thank you all for tuning in. We really appreciate it. If you have any topics you would like us to look into, you can comment below right here on this video. And you can also visit our website. It's hopkinsallchildrens.org/coronavirus. And we have a lot of wonderful resources there as well. Take care. We'll see you next week.